emergency measures bill that, of course, is the coronavirus rescue package designed to help millions of Canadians to financially survive this pandemic. Let me give you a look inside the Senate at this hour, where they have begun debate. The Finance Minister, Bill Morneau, there to answer some questions, obviously with a limited number of senators in the chamber. It comes after a 14-hour delay in debate on the main bill inside the House of Commons last night. The legislation finally moved from the House to the Senate at around 6 a.m. We are also, of course, as we do every day, expecting to hear from the Prime Minister on this and other updates from his government. He will be expected to talk about when this emergency aid will begin to flow, a critical question for many of you. So we'll bring you his daily address to the nation as soon as it begins. That is, of course, his front door. We've all become very familiar with it. Justin Trudeau now on his 14th day of self-isolation. Unclear when he will be no longer working from home, but he has completed the 14 days at the end of today. I want to bring in the host of Power and Politics, Vashi Kapellas, and the CBC's Catherine Cullen, both of them joining me now today. So we'll keep that Senate shot up when we can, as well as the one of the Prime Minister's front door. But there were, after we got past the various negotiations inside the House of Commons last night, which did change the bill in many ways in terms of allowing some more oversight of what the government was going to do, we did get more information this morning from Bill Morneau on what is essentially an amalgamation of two pieces that were going to help Canadians. It is now just called the Canada Emergency Response Benefit, and it means that all Canadians who have ceased working due to COVID-19 will be able to receive this new benefit. Vashi, I'm going to start with you just to go over some of what that means for Canadians.
Absolutely right, Rosie. They combined what was originally two different streams of money into one. The thinking behind it at this point, although yet to be tested, is that this makes it more accessible, easier technically to get the money out to Canadians. And it covers a wide range. I think this is the most important thing to get across to people watching today, is that before there were so many questions, and understandably so, about, okay, do I qualify for this? I'm not sick, but I have to stay home because my kid's school is closed. Like, am I able to access this money? I'm without pay right now. Here's what I understand the Prime Minister will outline, and what we've heard a bit of so far from Finance Minister Bill Morneau. The benefit would provide support for up to 16 weeks, I can say at this point. My understanding is, and the information I believe that's about to be released, is that would be about $2,000 a month for 4 months. So it would be a bi-weekly check, but it's about $2,000 a month. Here's who's covered: people who lost their job, people who are sick, quarantined, or taking care of someone who is sick with COVID-19. Parents, as I mentioned, who have to stay home without pay to take care of kids who are home because either those kids are sick or because the schools are closed, which is the case, of course, right across this country. Daycares, for the most part, other than for essential workers, are closed as well. Also, and this is a big one, I know yesterday we had Howard on who was asking about this, it will cover self-employed Canadians and contract workers. Also, the bar that you have to reach to access that money is pretty low, right? You just have to have been out of work for 2 weeks. That's my understanding at this point. I think there are a lot of really genuine questions about the ability to get that money out, how fast it will come, because there will be a wait for this. But I think at this point, at least, the government, and through this legislation last night, all parties agreed that it would be widely accessible to, a very wide swath of Canadians.
Yeah, Catherine, I mean, it does seem a little bit like an acknowledgement on the government's part that the first crack at this wasn't necessarily the best solution, that they needed something broader and something that they hope will work faster, although I guess there are still questions about the capacity of the government and the civil service to get this to people quickly.
Absolutely. I mean, we've seen the numbers, Rosie, really kind of staggering. Almost 1 million claims to EI last week compared to, I believe it was about 27,000 for the week the year previous. Now, talking to officials, they say, listen, they really are ramping up their process. They got, since last week, 100 and I believe it is 43,000 claims out the door. That's a big ramp up. Normally, they're dealing with 40,000. But when you compare that to the scope of this problem, obviously they're really not anywhere close to that yet. So a lot of work is being done behind the scenes in an attempt to try to get more personnel in place to deal with this, in an attempt to get the systems in place to deal with this. The government says essentially that it really is, along with the health and safety of Canadians, this is their top priority now, making sure that people get money into their pockets. So there's a whole area of scrutiny around whether or not they're going to be able to do that, whether the machine can move and move quickly. And we heard Bill Morneau talking in the Senate a little bit about that and the time frame. We know yesterday François Legault said publicly that the Prime Minister had assured him that the checks to independent workers would go out as of April 6th. Bill Morneau has said, well, that's the target week, essentially, to get money out the doors to people. So there's a question of, can it happen in a timely fashion? Obviously, people have rent, mortgage payments that are coming up before then. There's also the question of whether or not this goes far enough. People, for instance, who say they can't pay their rent, they can't pay their mortgages, they're not getting the help from the bank that they hoped. I had one woman just reaching out to me on Twitter, and she said, I'm a freelancer, I'm not making no income at all, but my income has been drastically reduced. My understanding is I don't qualify for this because I'm still taking in a little bit of income. What happens to me? So I think there are going to be a lot of questions about additional help Canadians need. We know the government has said this is just a very first step, but a lot of people are very impatient to see the results.
For sure. Let me just give a couple more details of what we know, because there are so many of you asking us on Twitter and in emails. If you are already receiving EI and sickness benefits as of today, you'll continue to receive those, and you do not need to apply for this new Canada Emergency Response Benefit. If you have applied for EI and you are waiting for your application to be processed, you don't need to reapply. This now will apply to you. So don't think you have to go in and do it again. And you should know that the portal for accessing this new Canada Emergency Response Benefit is not up yet. So don't panic when you don't see it. The government is intending to get that up by early April, which is why we're saying April 6th seems a little optimistic to start getting checks out. But you should, the government says, begin to receive your emergency benefit payments within 10 days of making that application. This will be a monumental feat if the government can actually pull this off. And I mean all the people behind the politicians who have made this decision. We'll go back to this because it is some critical information as more and more people in this country are laid off or put out of work. But first, as we wait for the Prime Minister coming up in about 8 minutes' time, let me bring in Premier Blaine Higgs. He is the Premier of Nova Scotia. He joins me now from Fredericton. Good to see you, Premier.
Good day.
Well, good to talk to you, rather. Let me, one of the reasons we wanted to speak with you today is because you are one of the premiers, maybe the only one, who has been very publicly calling for the government to put in place the Emergencies Act. Why is that needed for your province? Why do you think it's needed for the country?
Well, what I believe we need across the country is a national strategy. So we have consistency of healthcare measures. We have consistency of standards from one province to another. We have consistency of supplies. And we're not, each kind of competing with each other in terms of, well, what initiative do we put in place? What measure do we pute in place? In our self-isolation, what closes? What stays open? I think this is a situation where we should have learned a lot from other countries and their experiences. We can be learning a lot from other provinces. But the federal government can play an oversight role there in a consistent manner to ensure that every citizen in our country has equal access to health care and protective equipment through this crisis.
Now I can see you, so that's good. So you are, though, as I said, maybe the only premier who's this determined that, or this convinced that this is the answer. We heard, for instance, from the Quebec premier, who said he wants the most flexibility possible. He does not want the federal government, to take this stance. When you were on the call there with the Prime Minister the other day, what was your impression about the likelihood this might happen?
Well, I think the message kind of got confused with the legislation in the addition of the kind of the unfettered spending rules that were combined with the Emergency Measures Act and this bill that was kind of trying to get through in terms of the financial package. So I think there was a lot of concern about that, and I shared that same concern about that kind of inclusion of that spending bill. But this is different. This is in relation to having an ability to exercise a national strategy around the healthcare and the treatment of citizens and the distribution of equipment. I know everyone wants to do their own thing in some ways. The bigger provinces have better capability to do that. than others, and that would be the reason for standardization. That's why we have a standard healthcare system in our country, is to ensure that the same measures are practiced throughout. And in a crisis like this, we need to even be more confident of that.
You don't have an enormous number of cases now or yet. What is it that your province is lacking? We've heard different concerns across the country around medical supplies. What is it that you're lacking? What is it that you've asked the federal government to provide you with there?
Well, certainly we've given a list, like others, of critical components for equipment and testing reagents and masks and things like that. So we're currently fine in that regard with numbers. But we're anticipating, where this is going to go and watching the rise that we've seen elsewhere. We know our caseload is going to go up. I expect it to go up daily over the coming weeks, and because we know that's going to happen. But we want to head that off as much as possible. And I don't want to be in the midst of a crisis. Right now, our healthcare system is probably at a lower demand model than it normally is, because people are staying away from hospitals and people are not out moving around, which is exactly what we want. But I want to be prepared. And if we're learning something from other provinces, I want to make sure that that is uniform across our country. I want every citizen to feel secure no matter where they live.
Do you have another call scheduled with the Prime Minister soon? Do you expect to speak with him to make this case yet again?
Well, we likely will have another call in relation to our COF members to discuss some of the pending issues the longer this goes on in relation to the economy. Certainly in Atlantic Canada, the whole fishing industry is something that'll be at risk over the coming months and weeks. But yes, there isn't one scheduled this week, but I anticipate there will be. And as always, the Deputy Prime Minister has made herself readily available for any discussions, and she's done that from the very beginning. So we have access. We will continue to stay connected with the Prime Minister's office.
Okay, Premier Blaine Higgs of New Brunswick. Good of you to make the time today, sir, and all the best to the province and yourself. Appreciate it.
Thank you very much. Have a good day.
You too. All right, that's one other premier. We've been trying to talk to premiers through these specials to get a perspective of what's happening in different regions of the country. Everyone's struggling, obviously, with the same issue, but in different ways. I want to bring back the host of Power and Politics, Vashi Kapelis, and the CBC's Catherine Cullen as we wait for the Prime Minister to emerge. Let's just go back to, I wanted to get the premier on first before he got busy and I lost him, but let's go back to the Canada Emergency Response Benefit. Vashi, do we have a sense of why the government decided to now combine these two measures and what they're trying to do by doing this?
I think that they are, from at least people I've been speaking to, and I've been trying to get a sense all morning and last night as well, really worried about the technical capacity. Catherine and you were discussing just earlier, the ability to actually get the money out the door. They had been very brief on sort of one of the benefits that they had originally designed. They were specific on, here's who would qualify for it. The other one, we didn't even know how much it would be for individuals. We didn't know the timing of it. And so I think when they sort of sat back and saw at least from what I'm being told, saw the size of the need. So how many Canadians would be accessing it? And we saw that number last week, nearly 1 million people applying for EI alone. So you've got to think the numbers will be almost comparable when it comes to everything else, if not exceed that number. They were concerned about the ability, they are concerned about the ability to deliver that money to the people who need it. So this seemed like at least a streamlined process through which those claims could be made, and especially for, I think from what I hear, people who are self-employed, that was a big concern because it seemed as though you'd have to be sick or someone in your family would have to be sick in order to access that. So this is pretty explicit. Basically anybody who is out of work because of anything to do with the pandemic, it appears would be able to access this money, which once again, my understanding is about $2,000 a month for 4 months at this point. And the hope is obviously that money can get out the door. But like I said, the conversations I'm having, there is a bunch of concern. I mean, there are issues already with getting EI out the door, right, with processing times. Yes, the majority fall within that 1 month window, but I think it's upwards, at least the last study that was done, at least 20 to 30% of the claims take longer than that. And when they do take longer to process, it's a lot longer. Obviously, the sort of burden of proof is a lot different now, which could and should have an impact on that capacity to deliver the money. But I think this is unprecedented, right? As we've been discussing on so many instances and so many parts of this story, but also in this, they've never had this many EI claims in a week. They've never had to create this kind of benefit. So I think there remains a big question mark on the ability to deliver, which I know is not what people want to hear. They're nervous right now, and understandably so, about getting this money, as Catherine alluded to, in time. They're not going to get it before April 1st, likely, when they have to pay their rent and pay their mortgages, but they're also worried about May 1st.
And let me say further, they do have the employment insurance system, which is an old system. Everyone would agree with that operating. But they'll also have the Canada Revenue Agency operating. And as Catherine alluded to, there are lots more people working for both of them. There was one other precision, and a lot of people asked me about this. So we got clarification from Bill Morneau, the finance minister, in the Senate this morning. So he says that we've got about 2 minutes until the Prime Minister comes out, I'm told. Bill Morneau says that if you own a business and your business has been affected, you don't have any business anymore. It's a restaurant because you can't have people in and you don't have orders or what have you. So all of your employees now have been affected by COVID-19. All of them can now access the emergency response benefit, but the owner of the business can also access that benefit, which I think was something that was very unclear to people, self-employed people or people who owned their own small and medium-sized business before. This essentially means that anyone, as Vashi said there, who's affected in any way financially by the pandemic and the way it's affecting their business can tap into this. And Catherine, that seems to be a more direct or more complete response than perhaps we even saw last week. And I'll cut you off if the Prime Minister comes out.
Yeah, the goal officials are telling me of creating this Canada Emergency Response Benefit is, as Vashi alluded to make this simpler and more efficient. Simpler and more efficient for Canadians who are going to apply, simpler and more efficient, hopefully, for themselves. But we've got to say, Rosie, there is nothing simple about this. And while we talk about the mechanisms of how this is going to get out the door and whether or not it's in a timely enough fashion, the amount, too, I think, is a big question here. A lot of people are pointing out that, for instance, there are European countries where they're being a lot more aggressive in terms of how much of people's wages they are topping up. You look at the temporary business wage subsidy, that's an element of this where businesses are going to be eligible to receive about 10% of their payroll. A lot of businesses saying that is simply not enough. They'd like to see a lot more money from the government if they're really going to be able to sustain themselves. And for many businesses, this is a conversation very live right now, right? They're talking about being able to stay open or being able to keep functioning. Some of them are obviously have had to close their doors because of various states of emergency, but being able to do that in the matter of the next few days, the next couple of weeks.
So this answers some questions, but certainly not all of them. And again, as we've all said, there is a question of timeliness around this. We saw yesterday, something that was supposed to be debated in 4 hours ended up happening 15 hours after it was supposed to. All right, here is the Prime Minister of Canada to speak to all of you.
Good morning, everyone.
Right now, a lot of people are sitting around the kitchen table with bills, trying to figure out what needs to be paid and how to plan for the coming months. If you've been laid off, had your hours reduced, or are worried about your industry, these might be really stressful decisions. Far too many Canadians are having these tough conversations about finances and their future. Just look at the numbers. Last week, almost 1 million people applied for employment insurance. The hard truth is that people are out of work because of this crisis and worried about what comes next. So I want you to know that we'll be there to help you. Our government is doing everything we can to be there for you.
Early this morning, the House of Commons passed an emergency bill to help people as quickly as possible. The bill is now before the Senate. I do hope that its passage will be done quickly so that we can help Canadians as soon as possible. We will have more details about this later this week and further measures to announce. And this is only the beginning. But this new legislation will allow us to take the necessary measures to support you immediately. We will be enhancing the Canada Child Benefit and delaying by 3 months the time to repay student loans. And with this legislation, we are introducing the new Canada Emergency Response Benefit. This benefit will replace the two benefits we announced last week, the Emergency Care Benefit and the Emergency Support Benefit, in order to simplify the process. As I've been saying from the outset, set. As the situation evolves, we are adjusting our efforts to help you better. The Canada Emergency Response Benefit will provide $2,000 a month for the next 4 months to workers who are not getting a paycheck because of COVID-19. So if you've lost your job or you were working on a contract basis or were self-employed, this benefit will be there for you. If you're sick or in quarantine, or if you're looking after someone who is infected, this benefit will be there for you. If you have to remain at home without receiving a salary to look after your children or seniors, this benefit will be there for you. And even if you still have a job, but you're not receiving any salary because of the crisis, the new Canada Emergency Response Benefit will be there for you. There will be an online portal to put through applications. It will be available very soon, and people will start to receive money within 10 days of applying.
The Emergency Response Benefit will provide $2,000 a month for the next 4 months for workers who lose their income as a result of COVID-19. This will replace the two benefits we announced last week, the Emergency Care Benefit and the Emergency Support Benefit, in order to streamline the process. Like I said from the start, we will adapt our approach wherever needed. If you've lost your job because of COVID-19, whether you're full-time, contract, or self-employed, this new benefit will be there for you. If you're sick or quarantined, looking after someone sick, or at home taking care of your kids, it's there for you. And even if you're still employed but not receiving income because of this crisis, the CERB is there for you. An application portal will launch as quickly as possible, and people should start receiving money within 10 days of applying. I know people are concerned about delays. Families are worried about when they'll get help. It can be hard to get through on the line, and that is frustrating. Public servants are working around the clock while dealing with unprecedented demand and all of the same personal stress everyone else is facing. They will get to your application. Help is on the way. In order to speed things up, we're rapidly deploying workers from different departments to deal with claims. In the last 10 days, we've boosted the team by close to 13,000 people to take your calls, process your claims, and get you the support you need. And since last Monday, we've already processed 143,000 employment insurance claims. That means more money will go directly to people right across the country. We're working to get you the support you need when you need it. And if you're doing okay, there's a way you can help someone else, as an employer, a landlord, or even just a friend, so you can be part of the solution. It can make all the difference, because it's by working together that we'll get through this. And our team knows that. We're collaborating with the provinces and territories, as well as with First Nations, Inuit, and Métis Nation communities to coordinate our efforts and ensure that everyone is supported. Earlier this week, with the premiers, we also discussed testing for COVID-19. We know that how long you wait for your results varies widely. The premiers and I know we need to address that, and we are. This is something Minister Hajdu and I discuss with officials every day, and we'll continue doing what's needed to speed up results for everyone. But I also want to recognize the incredible work medical professionals are doing on this front. According to Dr. Tam, we're now testing about 10,000 people a day. That's a huge increase in numbers in a very short period of time. And it's because people across the country are working tirelessly to make it happen. At the same time, we're helping companies, labs, and scientific institutions produce and supply what we need most, from masks and ventilators to vaccines and antiviral drugs. We're collaborating with airlines to get Canadians home from abroad and instructing everyone that they must isolate at home for 14 days. We're also working with our international partners on this crisis. This morning, I had calls with President Sall of Senegal and President Kagame of Rwanda to share strategies on keeping people safe and addressing the economic impacts of this pandemic. I've also spoken to Prime Minister Abiy of Ethiopia and President Kenyatta of Kenya about international coordination. And tomorrow, I'll be speaking with other G20 leaders to discuss further global coordination to our response. Plus que jamais, c'est absolument essentiel que les Canadiens aient accès aux dernières informations. Mais comme tout le monde, les médias ressentent eux aussi les conséquences du virus. Pour faire en sorte que les journalistes can continue to do their work,
it is even more critical in the midst of a crisis, and therefore our government is announcing measures to support them. Minister Guilbeault will provide additional details later, but in the meantime, I want to thank all journalists and our Canadian media who are keeping Canadians aware of the latest developments with facts and reliable information. We very much appreciate your work.
Right now, it's more important than ever that Canadians have access to the latest news and information. To ensure that journalists can continue to do this vital work, our government is announcing new measures to support them. Minister Guilbeault will have more to say about this shortly, but I want to take a moment to thank our journalists and media for everything they do, today and every day. Above all, the most important way we can work together is by staying apart. Social distancing is our best tool to stop people from getting sick. I know people are seeing different graphs about how effective social distancing can be and new maps tracking the spread of this virus. Every time you turn on the TV or go online, you probably read something new. I know I do. And you'll want to know what's coming next. Today, I'll be getting the latest modeling from the Public Health Agency of Canada, and we'll discuss how to share this information even more directly with all of you. But you deserve the best information we've got about what's happening today and what tomorrow might bring, because otherwise, the uncertainty can be really tough, not just for your routine, but for your mental health, too. We're facing a once-in-a-generation challenge, and on top of that, you can't do many of the things that keep you feeling good, getting together with friends or having dinner with your neighbor. If you need help, reach out to your neighbor, to a sibling, to a friend, to a hotline. But do it from home. Don't go out unless you absolutely have to. If you're already following these rules, thank you for doing your part. If you aren't, know that you're making a dangerous choice. Because ignoring these rules puts every single one of us, yourself included, at risk. Voici la réalité.
This is the reality. If people refuse to follow the recommendations, our doctors and nurses have a more likelihood of contracting COVID-19. And if our healthcare professionals get sick, they cannot go to work. And therefore, they cannot take care of you if you get sick. Our country is facing the greatest healthcare crisis in its history. We cannot allow ourselves to put people at risk who take care of our health. So instead of inviting people over for dinner, don't do it. That puts everyone at risk. Grocers, technicians, bus drivers, farmers, people who collect our garbage, all of those people deserve better. We must protect them. It's not hard to do what we're asking you to do. Just stay home. If you absolutely must go out, keep a 2-meter distance between you and others. And if you are coming back from travel abroad, go directly home and stay there for at least 14 days. That applies to everyone. In order to come through this, we must all look after each other, and we must all do our share. I know that we can do this, and I know that Canadians are equal to the task. Thank you.
Bonjour, Monsieur Trudeau. Louis Blouin de Radio-Canada.
Radio-Canada. I'd like more clarity with respect to deadlines. April 6th is what Mr. Morneau is saying. Now, in terms of deploying this new benefit, what exactly will happen on April 6th? Will there be an online platform? And under that scenario, that means some people would not receive any help between the middle of April. So what are you going to say to people who need that help right away? First of all, we are working very hard in an unprecedented situation. We understand that there is great pressure to get that help to people as soon as possible. But we also know that there are many, many people who need to be helped in a very short time frame, and we need to develop the systems that can quickly work for us as long as they're reliable. And that is what the government is working on right now, and we do hope to be able to put that system in place by April the 6th with money coming in the following days. We hope that it will be very quick, and we hope to be able to get people applied for it well before that, and that's what we're working on right now. In terms of people who need help now, we know that some people are facing very stressful times. They've stopped working. They've been out of work for 2 weeks, and they're not getting paychecks coming in. So we'll do everything we can to help them with access to credit and other measures as necessary. We are here and listening to you, but we'll have to work very hard together in order to come through this.
We recognize that this is an unprecedented situation with an overwhelming amount of demand by Canadians to get money as quickly as possible. We need to make sure we're getting that money out quickly, but also reliably to Canadians, and that means doing things that government hasn't done before and scaling up our processes extremely quickly. We need to do that in a way that is going to be both reliable and quick, and that's why we're pulling together people from across government to get this done. We are hopeful that the system will be up and running by the 6th of April, and that checks or the direct deposits will be flowing days after that. We recognize that that is a ways off still, and there are people who stopped working a week and a half ago, 2 weeks ago, that are now receiving their last paycheck and not knowing when the next money is coming in. We recognize that. We're looking for ways to help people bridge through credit or other measures their ability to make it to the arrival of the Canada Emergency Response Benefit, but we will continue to work diligently and rapidly to make sure we're helping every Canadian we can.
Prime Minister Marika Walsh with the Globe and Mail. 60 business groups are calling on Canada to launch a wage subsidy that's in line with the UK and Denmark. So 70 to 80%, they say it would be much more efficient than the slow process that you're rolling out right now. You've been asked about this for several days now. Your question keeps being, things are still on the table, but people are laying off workers now. Now you seem to be saying that struggling businesses could choose to simply not pay their employees rather than laying them off, and the workers could then receive payments under this new benefit. Is that what you are urging struggling businesses to do, and why not go with the higher wage subsidy?
We are absolutely looking at more direct help for businesses. We recognize that in an ideal situation, businesses wouldn't have to lay off people, and people wouldn't have to feel like they've lost their job and don't have a job to come back to after this crisis. So we are working with business groups. We are working with small businesses, hearing their concerns, looking very carefully at the models put forward in other parts of the world, like Denmark and Germany and others, and looking at how we can make that work or make equivalent things work here in Canada. We will have more to say on that in the coming days.
We recognize that in an ideal situation, people would not be losing their jobs because of this situation, because of this crisis, and that employers should not have to lay people off. This is something we are trying to resolve with them. We know that there are some models out there that are working in Denmark and Germany, and we would like to help people directly through this Canada Emergency Response Benefit, but at the same time, we want to do things directly for businesses as well, and we will have more to say about that in the coming days.
I
Hi, Prime Minister. It's Annie Bergeron-Oliver with CTV National News. I know you just talked about more direct support for businesses, but can you be more specific in the meantime? You said it will come out later this week. There are many businesses that have already laid off people. There are people at home who cannot afford to pay their rent, and those checks are due very soon. What specific aid is available right now for people who are sitting at home who cannot afford any of their bills?
Well, for businesses, we moved very quickly to make credit available for them, to help them bridge through this time, to help them get the liquidity they need at a time of crisis and significant slowdown in the economy. For people at home, we recognize that loosening up rules around credit is also a possibility. We've taken certain measures on that. We know people are anxious. We know that their final paychecks from 2 weeks ago, from last week, are starting to come in now, and they don't know where the next one is going to come in or when the next one is come in. That's why the Canada Emergency Response Benefit is going to flow as a way of giving them $2,000 every month for the next 4 months so that we can get through this together.
Bonjour, Raymond Fillon de TVA. Monsieur le Premier ministre,
Prime Minister, you are now in your 14th day of isolation. Does that mean you are free now, starting tomorrow? Does your wife still have symptoms? Thank you for that question. Sophie feels much, much better, and the children and I still do not have any symptoms. We will continue to follow all the recommendations of our healthcare experts. What does that mean? Well, that means that every single day we follow those recommendations, and if the situation changes, we will let you know.
Good morning, Prime Minister. Janet Silver, Global News. With more than 1 million Canadians returning from overseas, especially in hotspots like Europe and New York City, why are we relying on the honor system and not using the Quarantine Act to isolate them, given we know that some people have boarded flights with symptoms just so desperate to get home?
Yeah. It is extremely important that everyone returning to Canada isolate themselves for 14 days. This is a measure that will both keep them safe and prevent further spread of coronavirus through Canada. This is something that we require of every single Canadian coming to this country. We will continue to tell people that. We will continue to highlight that. We will continue to require that of anyone coming into Canada, that they isolate at home for 14 days in order to protect everyone in the country.
How can you require it if it's not mandatory?
It is required for people to stay at home for 14 days.
But it's not mandatory.
Olivia Stefanovich, CBC News. Prime Minister, we've learned that sick Canadian travelers are masking COVID-19 symptoms to get through airport screening. Why does Canada not test temperatures, screen air passengers for fever, or use thermal screening at airports? Should there be thermal screening and consequences for those who mask their symptoms?
We recognize that there are many concerns about passengers returning to Canada, which is why we're asking people to immediately isolate as soon as they get home. It is a requirement. We also know that there are different countries using various technologies, and we will continue to look at what is the best way to keep Canadians safe. There have been a lot of discussion around thermal screening and taking temperatures and spot checks. One of the lessons learned from SARS is that it is simply not as effective as not effective the way people would like it to be, and it can sometimes give a false sense of assurance. This is what the best medical advice and best science advice we are getting is, but we are always open to hearing stronger or different science that says, or different recommendations that say it's worth, but we will make sure that what we choose to do, how we choose to deploy our resources are in the right way to actually help Canadians and actually arrest the spread of this virus.
But Prime Minister, should there be testing and should passengers who are returning to Canada, should there be consequences for those who mask their symptoms? And should these passengers also be forced to sign a document to make sure they self-isolate? How can you ensure that?
We know that people need to isolate when they land in Canada. They agree to an attestation in their processing when they arrive that they will self-isolate for 14 days. That is an important thing. And Canadians with symptoms will not be allowed to board flights coming home. That is a difficult measure, I know, for many people, for many families, but we need to make sure we're doing everything we can to keep Canadians safe.
But some passengers are masking their symptoms. What are the consequences for that?
Okay. We will continue to do what is necessary and have been explaining to people what it is they need to do in order to keep themselves safe and keep Canadians safe.
On va maintenant passer aux journalistes sur la ligne. Modératrice, c'est à vous.
Merci. Thank you. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, s'il vous plaît, appuyez sur étoile 1 maintenant. The first question is from Lavon Savance from Radio-Canada International. Please go ahead. Votre ligne est ouverte.
Yes, hello, Prime Minister. Canada, when you came to power, you announced that Canada is back. The United Nations is asking for $2 billion in emergency funding for COVID-19. Is your government prepared to join this fund? And is Canada setting aside equipment to send to countries that are very hard hit and cannot buy this equipment on the market?
In our $1 billion COVID-19 response announced last week, we had already set aside money for international efforts. We, of course, will work with the UN, continue to work with international partners on financial support to ensure that we can respond to this global pandemic with global resources. Canada will be there to participate. And I can also highlight on your second question that we are ramping up production of necessary equipment, of emergency medical equipment, of medications. We know that there is a potential need for much more in Canada, but there is certainly a need for much more around the world. And Canada will be part of the solution, not just to make sure that Canada has all the equipment and supplies needed for our citizens, so should the situation get worse, but we will have, hopefully, equipment and supplies to share with the vulnerable parts of the world that will desperately need help.
Merci. Prochaine question.
Thank you. Merci. The next question is from François Carabin, Journal Métro. Please go ahead. Your line is now open. La parole est à vous.
Bonjour, Monsieur Trudeau. François Carabin, Journal Métro, Trudeau.
It was mentioned yesterday that there would be additional medical equipment to help people who are infected with COVID-19, but on the ground there are nurses who are afraid they won't have that proper medical equipment. Are you able to guarantee the provinces that that medical equipment will be provided to them so that they can care for patients? Thank you for that question. This is something that we had a lengthy discussion about during my call with the premiers. We know that there are different needs at different times depending on the region of the country, and we will do everything necessary to ensure that every area, every region has what it needs to respond to the needs of infected individuals. We want that equipment to be shared across the country, but we will have to continue to deploy our efforts to increase the amount of equipment that is available and the essential equipment that people are looking for. And that's exactly what we're doing. But there has to be more coordination between the provinces and the federal government, and that will ensure that we can meet people's needs wherever they are in Canada.
Merci beaucoup. Dernière question.
Thank you. Merci. The next question is from Justin Ling from Freelance. Please go ahead. Your line is now open. Votre ligne est ouverte.
Hi there, Prime Minister. Last week I asked you about the possibility of reducing the prison population to help combat a potential spread of COVID-19. Since then, I've heard from prisoners, inmates, and guards who have said that prisons are not ready, that their release is not being contemplated, that there's not enough soap, that sanitary conditions are even worse, and that guards are being allowed into the prisons even after returning from abroad. What, if anything, are you going to do to continue reducing the risk in Canada's federal institutions, and is releasing inmates, nonviolent offenders, on the table?
We recognize that the incarcerated population is at greater risk of contracting and spreading COVID-19. That is why we are working closely with Corrections Canada to ensure that we're looking at a broad range of measures to keep both those who work in our correctional facilities, but also those who are residents there, to make sure that we're doing things that will keep them safe. I have said multiple times we are not taking anything off the table in terms of options in order to keep Canadians safe, and we will continue our discussions with Corrections Canada to look at options and to look at ways that we're going to keep people safe right across the country, wherever they be.
Je vous remercie beaucoup. C'est qu'est-ce qui mettra fin à la conférence de presse d'aujourd'hui.
Merci tout le monde.
Thank you. Merci.
And that is the Prime Minister of Canada wrapping up his daily briefing on COVID-19 pandemic. The major announcement today, as the legislation makes its way now through the Senate, expected to receive royal assent by the end of the day, is this new combined measure that was announced last week under a new name called the Canada Emergency Response Benefit, which means that many Canadians who are currently unemployed or about to be unemployed or just don't have enough money to make ends meet for all sorts of reasons related to the pandemic will now have access to this. Let me bring in my colleagues Vashi Kapelis and Catherine Cullen. Vashi, as you had rightly informed us before the Prime Minister spoke, it is going to be $2,000 a month. What else did you take from that?
A couple of things that I would flag, and the first, of course, on what so many Canadians are watching for, and that is the timing of this aid that is supposed to flow. At first, the Prime Minister said that, especially where this new program is concerned, that the application portal, so the page that you go on to apply for this, would be open as quickly as possible. And correct me if I'm wrong, but I thought I heard him later say that they were trying to get that going by April 6th, and then it would be 10 days after that that you would be able to receive those payments. I think that's something that we have to really closely watch. I think he was careful in his wording there not to guarantee that the portal would be up by April the 6th. And my understanding is there is still a lot of concern about even getting the application process going. So I think for people watching, that is something to definitely keep an eye on. Obviously, the sooner that application process gets going, the better for them. But there are no guarantees at this point. The other thing that I wanted to touch on was wage subsidies. And you and Catherine had talked about this. It's hard to overstate how significant this is for businesses right now. We have heard from so many organizations that represent, in particular, small businesses. The CFIB, for example, said that in its survey over the weekend, 1/3 of the businesses that they surveyed said they would not survive the month. They are asking for comparable subsidies to what we see in jurisdictions in Europe, so somewhere to 70 to 80%. The Prime Minister gave more details than he has or than any of his ministers have in the past on this, insofar as he at least said it was something that they're considering. He acknowledged that they perhaps should be looking at something that is comparable to those jurisdictions in Europe. However, again, no timeline attached. He said that more to come in the coming days. And the reason that I focus on the timing issue is because of that 1-month window that so many businesses are looking at. Look, people are, if you know anyone who runs a small business, you know that meeting payroll is hard in the best of times. When you have zero revenue, it becomes nearly impossible. Subsidizing 10% of wages up to $25,000 per employer, the consensus among at least those organizations organizations that represent those businesses is that that is not enough. So I'm very curious to see in the coming days, as the Prime Minister indicates, exactly what they're going to deliver on when it comes to that. And the third thing, just really quickly before you head over to Catherine, is the question around using the Quarantine Act. And this is something we've heard a lot of anecdotally as well, that people are, not even anecdotally, we've seen the imposition of states of emergencies, for example, in provinces, because people are not complying with that recommendation, which is, or order, depending where you live. When you come back from wherever you've been traveling, you have to self-isolate for 14 days. And the Prime Minister was asked why use the honor system? Why not invoke the Quarantine Act, which would, my understanding is, attach some sort of punishment or penalty and a level of enforcement to people who don't comply with that. He really avoided addressing why he wasn't going to use it or whether he would in the future, and instead just re-emphasize the message that we've heard over and over again, which is this is what's expected of you. But I do think he has sort of framed that in the past few days as this is my final warning. You got to listen to what I'm saying. So at the end of the day, will there be a consequence if people aren't listening? Or I don't know. It was pretty unclear. So I thought from my perspective, those were the big things to take away.
Yeah, I would point out that as he mentioned there, when you do come into the country, although this now applies in some provinces, but when you come into the country, you do have to hit an attestation on the customs machine that you go through, saying that you will self-isolate. I would imagine you could go back and track people and enforce it if we got to that point. But it does seem, Dave Seglins did some reporting overnight around people who are not being truthful, frankly, about their symptoms and where they're coming from. Although, as the Prime Minister also said, when they did, a vast postmortem on the SARS outbreak, almost 20 years ago, the temperature testing issue really didn't work, as the Prime Minister points out. So there has to be something that's different than someone just taking their word versus taking their temperature. Okay, Catherine, I'll get you to weigh in, and I'll also just make this point that an Angus Reid poll in the past week showed that a third of Canadians are very worried about not being able to pay for their rent and don't have much money coming in. So the urgency that we're all talking about here is a very real thing for so many people.
And there was one moment there, Rosie, where he said something I thought was quite interesting. I don't think we've heard from the Prime Minister before. He said, we're looking at ways to help people bridge through credit. Now, he didn't really offer any explanation of what it is he's talking about, what that might look like. I don't really know that is exactly the kind of help that most Canadians are thinking of right now. They want to be either eligible for these programs, and they may or may not be. They may want the amounts that they receive to be greater than that, but we got certainly a hint there from the Prime Minister that that's one of the options they're looking at least to help people get through until the aid he is talking about is delivered. Possibly beyond that, really, we don't know, but one of many questions that we're looking at right now. Another thing that I would raise, you and Bashi were just talking about the screening for people coming back to Canada. And I think to some extent there are two issues that are being mixed together there. I mean, the reporting that Dave Seglins did, the questions the Prime Minister was being asked, a lot of it had to do with people getting on airplanes in the first place, right? The government has said that if you are showing symptoms, even if you're a Canadian, you shouldn't be getting on an airplane coming from overseas. But obviously a lot of people are very afraid, and they know that in some cases the window to get home is closing. A lot of what the Prime Minister had to say was about self-isolating when you get back, but the government has said that they've enlisted the help of Canada Border Services, they've enlisted the help of the airlines, that they're trying to check people before they're coming onto the planes themselves. Then there's the additional question of what people do when they return in Canada. And I did think that was a bit of a poignant moment, and one that raises a few questions when he was being pressed by a reporter and said, why not make it mandatory? And he said, well, it's required. But of course, they're trying to encourage people to do this, but there is not any sort of measure that actually requires them to do it.
No, but there could be measures. So it's sort of people saying, as Vashi said, you either do it or we're going to make you do it. Okay, I'm just going to leave you two for a moment, if you don't mind, because speaking of people who wanted this information about employment insurance, about additional benefits, let's go to Rebecca Zirk now. She's in Saskatoon. She is self-employed, normally works at a salon, but like many other Canadians, her life has been upended, and she is very concerned about whether she'll be able to qualify for some of this help. Rebecca, good to see you. How you doing?
I'm doing well. Thank you for having me.
Oh, thanks for being here. So I don't know if you were able to hear the Prime Minister and whether any of that or anything we've said has clarified for you whether you'll be able to get some help.
Yes, so actually that has provided a good amount of clarity for me. I was quite concerned because what I heard previously was for small business owners for wage subsidies.
Yeah.
being self-employed and working in a salon, I'm the sole proprietor, I'm the owner-operator, I'm the only person. So 10% wage subsidy, I don't pay a wage to anybody but myself. Yeah. So 10% of my wage can turn out to be very little, and really is not enough to keep my business open after the quarantine and all the pandemic ends, or to even subsidize part of my living expenses. So I'm really glad to hear that it's more available to self-employed Canadians in that way.
Yeah, it sure is. So yeah, you will qualify, and the Prime Minister announces that you will get $2,000 a month. I would imagine that is not going to be enough, but you tell me how that will help you or not.
So it'll help keep me and my household getting by in the meantime. It's not a long-term solution, truly, for me. My concern is actually keeping my business open to have a business to come back to at the end of this. So what that'll do is keep my living alive. You know, it'll keep a roof over my head and groceries in my fridge. But what really the concern is the long term, truly, is having space to come back to cover the essential business expenses that I need to cover to stay employed after this.
And I understand your husband too, I'm not sure what he did before, but he also was he's also been affected by the pandemic and the economic consequences. What can you tell me about him?
So he actually received a layoff prior to the quarantine due to an economic downturn. So he had been on EI, I want to say he applied a week before a lot of the major non-essential services shutdowns were in effect. So he'd been struggling through the EI system because, one, it was overloaded with plenty of people who were affected by an economic downturn, and two, by the people who were starting the quarantine. So really and truly his interaction with employment insurance at that time was scary. It took a long time to get a lot of answers. We still haven't received much information from them about his claim. We're waiting hours on the phone to talk to anybody because, you know, I'm sure you can imagine people flooding the lines at this point, really.
And does that worry you? Does that worry you? The Prime Minister seems to say that this new portal, this new benefit, you'll be able to go sometime beginning of April to sign up, and you should get it 10 days later. You know, that's asking a lot, but he seems to think that that's sort of the timeline. Is that fast enough, or are you worried that it won't be in your hands fast enough, that benefit?
I'm very concerned about it not being in my hands fast enough, because the concern is I've already been quarantining for almost 3 weeks. I've been out of work for almost 3 weeks. I'm immunocompromised at this point in my life. So I chose working in a salon. You can't social distance that way. I made the decision 1 week before the mandatory close down. And also with my husband being on EI as well, being on a layoff, I'm really concerned that we're going to be waiting 5, 6, 7 weeks before we receive any kind of support. Because I can imagine that receiving payment 10 days after application is quite optimistic with the amount of people that'll be applying.
So if you could say something to the Prime Minister or the Finance Minister about your situation, what other Canadians like you need urgently, what would you tell them?
Other Canadians like me, we need immediate support for entrepreneurs, truly, to keep their businesses, keep their jobs, keep them in the economy during this. And also immediately some sort of immediate relief that requires no kind of application program, like a universal benefit, so that we can subside and not be in this constant panic waiting for this relief to be released after everybody else has applied. There needs to be some kind of universal program that is default. As a Canadian citizen, you receive XYZ, this amount, just for being a Canadian citizen.
How is your health? You said you were immunocompromised, but I guess you've been locked down in your house. Are you feeling okay?
I'm feeling well. I'm healthy. I'm nearly 20 weeks pregnant, so I'm keeping very far away from everybody right now.
That's a good decision, and my congratulations. Okay, well, I hope you got some better information there, and I hope you get what you need there from the government, and we appreciate hearing from you. There's a lot of people out there like you right now, so good thoughts to you and your husband. Thanks, Rebecca.
Thank you so much.
All right, let me go back to my colleagues, Vashi Kapellas and Catherine Cullen, as we wait now for the press conference, the daily press conference from the COVID-19 Cabinet Committee. And I should tell you that the Senate, I believe, is close to voting now on this legislation, after which, of course, it will receive royal assent. It is good to put faces. I only have about 2 minutes, but it is good to put faces to these stories. I mean, lots of people have been reaching out to all of us, which is one thing, but to talk to people about how they're affected and the very things that we think are something people need to think about. And that for Rebecca was certainly the timeline here, Vashi.
Yeah, the timeline is going to be so significant. And I think also there are still, judging by social media right now, and I know our inboxes as well, a lot of questions coming from Canadians still about, okay, I'm a student, I don't have any opportunity for work, do I qualify? Like those qualification questions are still really significant. I would urge them to continue watching as various ministers start speaking publicly, and those questions will be posed to them. So the need is out there for more answers, certainly.
About 30 seconds, Catherine.
Yeah, I'd just say the government said again today, the Prime Minister said, this is only the beginning. And so the question is, what is going to come next, not only to help people like Rebecca, but other people who aren't caught up by this program, but who are absolutely caught out by this outbreak, Rosie.
Okay. Vashi and Catherine, thank you for your help with this part of our coverage. We'll be back to you, of course. So the big news today, as this legislation winds its way now through the Senate, making its way into law by passage of royal assent later this afternoon, an $82 billion financial aid package. But perhaps most importantly, for those of you watching, this new Canada Emergency Response Benefit, which will give many, many Canadians access to $2,000 a month for a 16-week period. You can look for more information on the government's website when it becomes available, which is one of the big questions. How quickly can this money roll out? So many of you waiting to pay some bills by the end of the month. So more information as we get it. I'm Rosemary Barton. This is our special coverage of the COVID-19 pandemic. You can continue watching on CBC News Network and CBC.ca, streaming around the world. I'm Rosemary Barton. Thank you. And welcome back to our special coverage of the COVID-19 pandemic as we wait for our daily briefing from Cabinet ministers and public health officials about announcements the Prime Minister made earlier today and the state of the pandemic in this country. I'll bring in Vashi Kapellas and the CBC's Catherine Cullen right now just to give us a sense of what we might hear here. And then I want to, if I can, get to a couple people I have on the line who are stuck in Peru because this is, of course, the other part of the story. So many Canadians trying to get home desperately. Vashi Kapellas, what will you be wanting to hear more about from the minister shortly?
So a couple of things. First, on what you just brought up, I'll be interested to see if there are any updates on the specifics of those flights that we know are supposed to be coming from places like Peru, a whole host of other countries as well. So I'm keen to see if there is a more specific timetable for some of those flights. I know so many of those Canadians watching around the world right now are keen to find those answers as well. The second thing is on what we've been speaking about for the last hour, and that is the government's announcement that they've combined the benefits basically into one stream. A statistic that Prime Minister put out there just minutes ago that I think is worth flagging when it comes to this idea of when will the money come, how fast can it get into the hands of people who need it right now. He mentioned, and he had already released the statistic, that 929,000 people applied for EI last week. He said 1,300 civil servants have been basically redirected to handle those. Well, he said 13,000, but he meant 1,300. Had been redirected to help those claims get processed. But I believe the number he put out for how many had been processed was about 143,000. And I did some math, which rarely happens, but I did it, and I had other people check it just to make sure it was right because I'm often wrong. But that's about 15.4%. So that's of regular EI claims in a system that already exists because the system is so overburdened by a number it's never seen before. I mean, keep that in mind. They are working tirelessly, those civil servants, to get that money out. But even in that system that exists, they've only been able to process 15% of the applications. So I think, let's find out what kind of system is going to, handle this other benefit. What measures have they put in place, or do they plan to put in place to try and alleviate some of that procedural stuff? And how fast do they expect that 10-day mark that the Prime Minister put out to be met?
Because even if, as we talked to our friend Rebecca, who had her own hair salon, even if $2,000 is not enough, it will keep people with, as she said, a roof over their head and groceries, but you have to actually get it. You can't be waiting another 2-3 weeks. So that's pretty critical. Catherine, I'll get your perspective before I go off to talk to a couple guests.
Certainly those questions about the mechanics of how all of this is going to work. The Prime Minister is taking this role of trying to be the sort of reassurer in chief, if I can put it that way. But there will be questions for the cabinet ministers about the mechanics itself, how it's going to get done. Also, a lot of the focus today has been on questions around financial measures. That's understandable, particularly with this piece of legislation. But there are still, of course, outstanding questions, Rosemary, about things like testing. Canada, government officials keep saying they want to see more testing done. We see the numbers jumping up day in and day out. And yet there is still a demand for a lot more of that. And I know, again, when we talk about the questions we're getting from viewers, a lot of people are asking, when are we going to start seeing much greater levels of testing?
Yeah, and we will probably get an update in the press conference shortly on that very issue. I'm going to put you two on standby for a moment and go to Norma John and Philip D'Souza. They are Canadians stranded in Peru. They are confined to their rooms because a fellow traveler died from COVID-19 in their hotel earlier this week, and we have reached them in Cusco, Peru. Good to see you both.
Hello. Good day.
Good morning.
So it was a friend of yours, or I think maybe a son-in-law that reached out that said that you were both stuck there. At this stage, you do not have a government flight out. And Philip, I believe you have some underlying conditions. So let me first ask you, Philip, have you heard anything from the government about a flight for you?
Most of my communications Norma handles in terms of via the cell phone. Personally, of course, I am not in connection. But
we have heard nothing about getting any of us out from Cusco as yet. There was a flight that left yesterday from Lima, and apparently there's another flight Thursday and Friday, but we are not on those flights as far as we know.
And Norma, what are your concerns about, Philip is your brother, I believe. What are your concerns about Philip's health and the need for him to get out of there quickly?
He has high blood sugar level. And no for exercise right now because there's no room here. They are delivering the food every day, which is really fortunate for us. The food is all full of carbs. It's little vegetables, all the things they should not be eating. So I'm just concerned that we have more of a chance of getting the virus because it's obviously they're trying to contain it. And we just so want to get to our own homes and be self-isolated for however long it takes. 4 days, we don't care. We just want to please Prime Minister Trudeau and Champagne, please work on getting those planes to Cusco, to Arequipa, to all the other places.
So the connection is not great. I will tell people, but because I know some of the history here, I know that Philip does suffer from diabetes, and so you're running into problems with diet and exercise and other concerns. And I did hear the plea very clearly at the end, though, around Norma from trying to get both the Prime Minister and the Minister of Global Affairs to get a plane to Cusco. I believe something's in the works, but I am not sure. So I'm going to leave it there only because the net connection is not great, but the message was received loud and clear, and I hope you get news soon. We'll check back with you if you don't mind. Thank you very much. That's a couple of Canadians.
Thank you so much, Rosemary.
Thank you. Okay, bye-bye. They're trying to get home to Mississauga, and as you heard there, contrary to what some other Canadians are not doing, they are happy to self-isolate if they get home, because that would, of course, be required. We'll check back with them and try and get a better connection, too, if we can. As we wait for cabinet ministers to give us an update on some of the government announcements today and the ongoing situation of the pandemic in this country, let me bring in Dr. Suman Chakrabarti. Good to see you, Doctor.
Hi, good morning.
So let me start with that question there that the Prime Minister got a couple of times, and we've done some reporting on today. This issue that people are not supposed to be getting on planes if they have symptoms. They're not allowed on planes. It is being left to airline companies to sort of, give a once-over. And, of course, the onus is on the Canadian to admit that they may or may not have symptoms. Should or is there anything else the government could be doing to either check the health of people trying to get on planes or enforce the 14-day isolation? Because once you get on the plane, if you have any symptoms, that becomes very problematic.
It's true. It's a very difficult situation, and one that's tough. Even if you do have a fever, it's tough to monitor. So let's say if you had a fever 6 hours ago, you may not have one right now, even without using something like Tylenol. So I think what they're generally doing is if somebody clearly looks ill and they're coughing, they're not letting them onto the flight. So that's the first thing. The other problem is with the airport screening, it doesn't work very well. You can miss more than half the people who may be sick and just don't even know it. And that's why it's really important. What we put the stress on is for having people watch their symptoms once they leave the airport, and of course that 14-day isolation. I really urge people to continue to keep this isolation going, especially when you come back from travel. We know that everything is not off the table. We might see the Quarantine Act enacted in the next couple of days if things are not improving. But I hope everyone working as a team here and staying isolated if you feel ill or if you've come back from travel.
The ministers are coming into the room, so just about 30 seconds, Doctor. There is this ongoing issue of testing. We're up to about 10,000 tests a day in this country. Obviously, I think the government would agree. Everyone would like to test more. Is that something you would like to see as well? What should we be doing?
I agree. We should be trying to test wherever we can, both mild cases as well as severe cases. And we will see a ramping up of that in the coming days due to working behind the scenes with public health and the government.
Okay, Dr. Suman Chakrabarti, I can see you're at work, and we appreciate all the work you're doing and the time you're taking to talk to all of us. Thanks again, Doctor.
Thanks for having me.
Okay, let's go back to Ottawa now, where we can tell you that the Senate has, in fact, passed the legislation on the COVID-19 financial aid package. It's off to royal assent. Let's listen into the Deputy Prime Minister, Chrystia Freeland.
Joining us this afternoon.
So let me just start with an urgent reminder to Canadians. You must practice physical distancing, stay at home, limit or eliminate contact with people at higher risk, particularly our beloved seniors and people in poor health. Keep a distance from others. And of course, if you are doing an essential job, if you are, for example, a healthcare worker, one of the Canadians making sure we have food on our grocery store shelves, one of the people making sure we have lights and heat in our homes and buildings, thank you very much for the hard and important work you are doing.
An urgent reminder to Canadians. You must practice physical distancing. Stay at home. Limit or eliminate all contact with people who are at high risk. Keep a distance of 2 meters from others.
People are no doubt aware. Parliament last night passed the COVID-19 response plan. I'd like to thank all members of the House for that work. I'm glad that we got there. Today, we will hear from Canada's Deputy Chief Public Health Officer, Dr. New, from the Minister of Indigenous Services, Mark Miller, du Ministre du Patrimoine canadien,
Minister of Canadian Heritage, Stephen Guilbeault, our Minister of Finance, Bill Morneau.
And then also with me to answer your questions are the Chief Medical Officer of Health at Indigenous Services Canada, Dr. Tom Wong, our Minister of Employment, Minister Carla Qualtrough, and of course, le Président du Conseil du Trésor,
and the President of the Treasury Board and Vice President of the COVID-19
Dr. New.
Committee.
Bonjour. Globally, there are over 420,000 cases of COVID-19 affecting every country around the world. In Canada, as of this moment, there are 3,197 cases of COVID-19 and 27 deaths. We have now tested over 142,000 people in Canada, which is more than 20,000 additional people tested since yesterday. In the early part of the outbreak, most of our cases were linked to travel outside of Canada. While more cases now are community-acquired than are travel-related, we still need to do all that we can to reduce the impact of travel-imported cases. For all of those already in self-isolation, we know this has been difficult, and we are grateful for the sacrifice you are making to keep others safe.
If you don't have any symptoms, you can go outside for a walk, as long as you at all times stay at least 2 meters from others. As always, don't touch common surfaces such as door handles, and wash your hands carefully after you leave home and as soon as you're back at home. For those who do develop symptoms, regardless of how serious they are, you must stay at home at all times. Online tools will help you to determine if you need a greater evaluation or whether you need a COVID-19 test. Please look at what is at Canada.ca.
If you're not experiencing any symptoms, it's okay to go outside for a walk, as long as you maintain at least 2 meters distance from others at all times. But as always, avoid touching common surfaces like handrails and doorknobs, and wash your hands thoroughly before you leave your home and as soon as you're back inside. But for those who do develop symptoms, no matter how mild they may be, you must remember to remain inside your house at all times. There are online tools that will help determine whether you may need further assessment or testing for COVID-19. Check out the one on Canada.ca. Right now is an extremely critical time for all of us to get it right. We need to get this done. Let's plank the curve. Thank you. Merci.
Okay, thank you very much, Dr. New. Now we will hear from our Minister of Indigenous Services, Mark Miller. Mark, please.
Kwe-tanse, ulukut, good afternoon, bonjour, sego. First Nations, Inuit, and Métis are among the most vulnerable groups in Canada. And during this crisis, in particular, those in remote and fly-in only parts of this country are uniquely vulnerable. And I want to reiterate that my sole priority, one that is shared by the Government of Canada, is the health and safety of Indigenous peoples in Canada. We
recognize that the COVID-19 situation in Canada is evolving rapidly.
As part of the COVID-19 economic response plan announced by the Prime Minister last week, our government is providing $305 million through the Indigenous Community Support Fund directly to First Nations, Inuit, and Métis leadership to provide them with the maximum flexibility possible to do what they need to support their communities in a time of crisis. The allocation of funds reflects discussions we've had with First Nations, Inuit, and Métis partners in each province and territory about their unique and specific priorities during this pandemic. These funds will flow directly to Indigenous communities with maximum flexibility to help adapt responses to address local needs. We will do this quickly and with a sense of urgency that this situation obviously necessitates. I want to stress that this is only one of the financial measures that we are contemplating for First Nations, Inuit, and Métis.
This may lead to increased support for seniors, food support, help for children, and help for those who are unemployed, mental health support, or even emergency intervention services. That's just the beginning.
The First Nations portion of this is $215 million. Each First Nation will get a base amount adjusted for population, remoteness, and community well-being. The Inuit portion is $45 million and will flow to each of the 4 Inuit land claim organizations through an allocation determined by ITK and regional leadership. For Métis, there will be an amount of $30 million, which will flow through each governing member. The remaining percentage, which accounts for $15 million, will go to supporting regional, urban, and Indigenous organizations supporting those who live away from their communities.
This fund is in addition to the funding already announced for communities, and it will allow us to address public health issues quickly by, for example, providing equipment and emergency planning support.
Of measures taken by communities to protect their populations, from closing their borders to declaring local states of emergency. I want to recognize their important work and the strength that they have shown But let me be clear, this is just the beginning. We know that more support will be needed, and we will be there to make sure no Indigenous community is left behind. Our government is here to support you during this time. Miigwech, merci, nakumik, thank you, merci, nyawangoa.
Okay, thank you very much, Mark. Now we will hear from le ministre du Patrimoine du Canada.
Minister of Canadian Heritage, Mr. Stephen Guilbeault. The floor is yours. Thank you. Good afternoon, everyone. I think we can take some time to recognize how the current situation shows that we have to show solidarity and take care of each other. This is a very complex situation and is evolving rapidly. All sectors involved have to be taken into account. There are journalists who, in normal situations, and particularly in crisis situations, are experiencing great difficulties because they lose ad revenue.
It's crucial that Canadians can obtain authoritative, well-sourced and factual information related to COVID-19. This is why the Government of Canada is taking immediate action so Canadians can continue to access diverse and reliable sources of news.
First, I'm pleased to announce that on behalf of my colleague, Diane Le-Boutillier, the Minister of Canadian Revenue, that the independent committee that is working with the CRA is going to implement tax measures announced in the 2019 budget. They are now formal. Moreover, that based on the $30 million invested on our government in a national awareness campaign about COVID-19, this will be invested in Canadian media, whether it's on TV, in newspapers and magazines or online, so that the revenues generated by this campaign breathe new life into our media. The Minister of Public Works is working on this file so that this can be implemented quickly.
National information campaigns, I want to mention the initiative of the Canadian Medical Association, the Royal College of Physicians and Surgeons, and the College of Family Physicians of Canada, coordinated by the Canadian Public Health Association and supported by Volunteer Work and Advertising Agency. Together, they are preparing a public health campaign and partnering up with Canadian media and online platform to air it. This is a reminder of how Canadians can pull together to help each other. Finally, because immediate access to liquidities is critical for many editors and publishers, the Department of Canadian Heritage is putting in place a simplified application process for the Canadian Book Fund and the Canadian Periodical Fund. This means that beneficiaries of these programs will be receiving their 2020-2021 funding within the next few weeks as opposed to the next few months. We take these measures to ensure that all Canadians can receive factual information related to COVID-19 and to support our media and cultural organizations. Thank you. Merci.
Okay. Merci, Stephen.
Thank you, Stephen.
And now we will hear from our Finance Minister. Bill, please.
Thanks, Christian. Thank you. First of all, let me say thank you to all of the parties that worked together last night to get unanimous consent on our legislation, allowing us to move forward with the measures we know we need to move forward with to support Canadians during an extraordinary time. As you've heard me say, extraordinary challenges necessitate extraordinary measures. And that is indeed how we've gotten to where we are with the benefits that we are putting forward to support Canadians, the benefits that we're putting forward to support businesses, and the benefits that we're putting forward to support our economy. So I'd like to walk through with where we are right now. We have realized over the last week that the very best way that we can support Canadians who are out of work, who are sick, who are in a situation where they're supporting an elderly parent, who are in a situation where they're at home because they're protecting themselves and their families, is by having one emergency benefit. So in the legislation we move forward with, it's one emergency benefit, the Canada Emergency Response Benefit. And the idea is that we are going to deliver for every Canadian that finds themselves in a situation where they've earned revenue in the past 12 months of $5,000 or more, and they don't have any income as a result of COVID-19, they can get this benefit. It's $2,000 per month for 4 months. So what we're doing is ensuring that we enable people to bridge through this very difficult time so they have the resources they need for themselves and their families. We've designed this in a way so that it's a wage subsidy delivered directly to employees, to people. So what this means is that for an employer, they will not have to separate the employment of their employee from their organization. So in that way, we're directly supporting employers. They will just be in a situation where if this employee is no longer receiving income from their company, they can in fact be guaranteed that this employee will be able to apply in a simple way and get access to $2,000 per month for 4 months. That is, we think, critically important. What we've done over the course of the last week is to make sure that these benefits can be delivered in a simple and efficient way, getting money into people's pockets as rapidly as possible. We're working hard to make sure that administration is able to be done. We're targeting the week of April 6th for us to be able to deliver on this for people. That's important. There's more work to be done to ensure people that we can deal with the very large volumes, and that work is being done by my colleague, Carla Qualtrough, my colleague, Diane Laboutier, right now as we think about how we can best deliver on that. What this means for our overall economy. The impact of what we're doing for the economy is very significant. The approach we've decided to take means that we are entirely funding this through the federal government. And that means that the estimates in terms of the kind of economic support that we're giving are significantly different than they were last week. So rather than the expectation of direct support to Canadians and to small businesses of $27 billion, we are expecting right now that direct support be budgeted at $52 billion. So that is a significant change because of the scale and the significance for people of these benefits. So when you look at what we've done, that's $52 billion in direct support expected. And on top of that, there's $55 billion in tax deferrals that we've said are there because neither individuals nor corporations will be forced to pay their income tax before August 31st. So a total package of $107 billion into our economy. I spent some time yesterday on the phone with G7 finance ministers. The day before, I spent some time on the phone with G20 finance ministers. And what I can tell you is Canada is taking a very, I would say, appropriate, but also significant approach to responding to the incredible challenge that we're facing today.
I would like to say that it's very important for us to have a situation where people, regardless of their situation, if they don't have income over the next 4 months, for them to be able to have $2,000 a month for 4 months. That means it's a direct wage subsidy to people and will also help companies. That's very important. So we're going to continue to look at how we can shift the situation for small and medium-sized enterprises. But right now, with these measures, it's important to see that we have assistance for people, a total of $52 billion in direct support. And with the tax deferrals for individuals and companies, they can take up to August 31st to pay their taxes, and this will inject another $55 billion in revenue into our economy. It's a total of $107 billion. So we can look at how we can be aggressive to deal with this situation today. Thank you very much. And of course, I'm happy to answer your questions.
Okay, thank you very much, Bill and all colleagues, and we are indeed ready to answer your questions.
Okay, as agreed, we'll start with 3 questions on the phone, and then we'll get back to the room. So, operator.
Certainly, thank you. Merci. Please press *1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. There will be a brief pause while participants register for questions. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Thank you for your patience. Merci de patienter. The first question, la première question, is from Christy Kirkup from Globe and Mail. Christy Kirkup de Globe and Mail. Please go ahead. Your line is open. À vous la parole. La ligne est ouverte.
Good afternoon. Thank you for doing this again today. I understand that the health minister just told the upper chamber that as of midnight tonight, that powers in the Quarantine Act are going to be used to ensure that travelers other than essential workers are going to be subject to a mandatory 14-day isolation. My question is to the Deputy Prime Minister. Can you just speak to why the government is now taking the specific step to ensure that this self-isolation for travelers is indeed mandatory? And are you planning an enforcement tool to go along with this? Because how are you going to police people?
Thank you very much for the question. And let me just reiterate that, yes, the health minister will be using powers that she has under the Quarantine Act beginning at midnight tonight to impose a mandatory 14-day period of isolation on all people coming into Canada from outside Canada. This issue was discussed at length at the Coronavirus Cabinet Committee on Monday. All Canadians have been working very, very hard to practice physical distancing in their lives, and we have for some time now been urgently advising people coming into Canada to self-isolate for 14 days upon their return. We have decided that now is the time to make that measure mandatory. I think we all really appreciate that it is so important to have this self-isolation to protect the health and safety of Canadians. And I may turn to Dr. New to offer some, would you like to offer a public health perspective?
Yeah, certainly from a public health perspective, we've been repeating many times that it's important in terms of physical distancing so that individuals don't expose each other potentially to the virus, and also the public health principle of the 14 days being the outer limit for an incubation period. And so respecting those public health principles, the minister has also said repeatedly, travelers coming back to Canada, you might have been exposed because everywhere in the world there is COVID-19. So when you come back home, it's important to protect your fellow Canadians by self-isolating for 14 days. So this is just an appropriate step, certainly from a public health perspective.
And I will just add, we had the Prime Minister led a call with the premiers of the provinces and territories earlier this week. We have seen the provinces stepping up and taking more clear measures within provinces and territories, including some provinces and territories imposing restrictions on travel from outside the province and territory. I think all Canadians understand that this is a serious situation. It will get worse before it gets better. As a country, we are lucky to have an outstanding national healthcare system and terrific healthcare professionals, but we all need to do what we can, as we heard from Dr. New at the beginning of this, to flatten the curve and indeed to plank the curve, and this mandatory isolation will help all of us do that.
Thank you. And just as a follow-up, I was wondering, for the finance minister, we understand that your department has been talking to banks about possibly using them to distribute money to businesses specifically. I'm wondering if the minister can please provide a specific update on how these talks are going.
Thank you. The banking system is a source of strength for Canada. We have, I believe, the strongest banking system in the world. It enables us to work together with the banking system to make sure that we can actually provide the kind of credit that businesses need, businesses of all sizes. We're working together and have been working literally overnight over the recent days to make sure that we have not only the support that we outlined last week, the Business Credit Availability Program, the backstop of the Business Development Bank of Canada and Export Development Corporation for small business and medium-sized business loans, but also the capacity for the banks to deliver on all sides of businesses the kind of credit they're going to need to get through a challenging time. I would say that those discussions are going very well. The banks are working well together with us. but we don't have anything final to report in terms of exactly the parameters of how we're going to move forward. And when I do have those final parameters, I'll be coming to be transparent as rapidly as possible.
Thank you. Operator, next question, please.
Thank you. The next question is from Lena Dibb from Canadian Press. La prochaine question de Lena Dibb de la presse canadienne. Please go ahead. Your line is open. À vous la parole. Votre ligne est ouverte.
Merci.
Thank you. Mr. Morneau, I have a question for you about the new benefit. The problem that everyone has said is the distribution of funds, and some people won't get these funds for at least 3 weeks at least. So what are you going to make sure that the people get their funds quicker, that you can reach everyone? Thank you. That's a very important question. Over the past few days and weeks, we've worked together to ensure that we can have a simple and efficient approach so that we can quickly get funds to Canadians, which is necessary in our current situation. So we found a few systems within the federal government that can help us to have a very efficient and quick approach. It will take a few days, and I'm sure that we have to make sure that the system is working properly. And I know that we have to do this as quickly as possible, and that's exactly what we want to do. Today, we think that in the week of April 6th is when we will be able to deliver these funds for Canadians. But if there are any new, if there's any new information, we will be giving it to you day by day, and it's really important to know that we're absolutely in a situation where this is the most important thing for us every day. Myself and Carla Qualtrough and Ms. Leboutier are looking at these very important systems. I understand your efforts, but it won't be quicker. It'll take another 3 weeks. Even if we talk about the 10 days that could be added to the date of April 6th, as the Prime Minister said. So there could even be a portal, and it might not be able to work. Can you comment on that? I have another question about the quarantine that Minister Hajdu is imposing, and given what's happened in the U.S., what are you going to do to impose this quarantine? I understand that we're ordering people to quarantine themselves, but do you have the means to check people who are entering the country and to follow up with them over the 14 days after they enter the country? Thank you for your question. With respect to the quarantine, this is a change. Now we're talking about a mandatory quarantine. And obviously, we will have mechanisms in place to enforce the quarantine. That will be for all travelers from abroad, including travelers from the U.S., except for workers who do essential work. And I also like to, what mechanisms, she asks, answer. I would like to underscore that our advice hasn't changed. For a few days, we firmly advised all travelers from abroad to self-isolate once they enter Canada. The change is now that until midnight today, as of midnight, the quarantine will become mandatory. But what mechanisms are you talking about, she asks? One follow-up question per colleague, please.
Thank you, merci. The next question is from Althea Raj from HuffPost Canada. Prochaine question d'Althea Raj de HuffPost Canada. Please go ahead. Your line is open.
This wasn't going to be my question, but since you didn't answer it, what enforcement mechanisms are you going to use to ensure people are staying home and abiding by this quarantine?
It will, from midnight tonight, be a legal obligation of people entering Canada from outside Canada to self-isolate for 14 days. I do want to emphasize Essential workers are excluded, as has been the case with the strong advice from the Prime Minister, from public health officials for some days. In terms of the specific penalties and enforcement mechanisms, we will be giving you more information later today.
Okay, thank you. And my question is actually for Bill Morneau. I want to talk about the bill, yesterday's bill. I'd like to know what made you think that it would be a good idea to ask Parliament for the powers to tax and spend without their approval until the end of 2021, not even this year, but next year. What made you think that was an appropriate response to this crisis?
Well, thank you for the question. And I think what I should start with saying is that I'm pleased that we got last night, actually at 6 a.m. this morning, to unanimous consent with the other parties to move forward on our response plan for Canadians. We know that this is an extremely challenging time for people, and we need to respond appropriately. The bill that we got to, that was worked through the system, is one that will allow us to have the abilities that we think we need. What I can say is that last week, you heard me say to Canadians that we will do whatever it takes to support them and to support our economy through this challenging time. And what you're seeing is that as we move forward, we will do that. We will think about how we can have the ability to move quickly, to respond to challenges, events that are in many cases completely unforeseen. What we see not only in Canada but around the world is that the issues that we're facing one week are different, significantly different in many cases than the issues we saw the week before. Canadians expect us to be prepared to deal with these challenges, to have the ability to move quickly, to have the funding so that whether we need to buy personal protective gear on a moment's notice because we can find it, or whether we need to support a province that's in an extreme challenge because of their situation, that we have the capacity to do that. So we are seeking to make sure that we have the ability to do that. We know that sometimes these authorities will be required at an unprecedented speed. You're hearing Christia talk today about the need for us to get back to you with details this afternoon on important measures. We are working in order to make sure that we have the capacity to protect Canadians, to get ourselves through this, and to come out of this challenge. This is, we expect, a very challenging time, but a temporary time, to come out of this challenge with our economy intact. We, unfortunately, do not know either the depth nor the duration of this challenge, and that's why we are keen to be working together with other parties to make sure we continue to have that capacity to respond in a very, very timely way to every challenge that we see.
On va prendre 3 questions dans la salle avant de retourner au téléphone.
3 questions in the room before we go back to the phones.
Julie Van Dusen with CBC. Ms. Freeland, Donald Trump, American president, is looking towards Easter, which is April 12th. He wants American workers back at work then. Can Canadians expect to be back at work around the same time?
Thank you for the question, Julie. Our approach in Canada is to act very much in accordance with science and with the advice of our excellent public health officials. Many Canadians are at work today providing essential services, and I know that all of us are really, really grateful to those Canadians. As for Canadians who are doing non-essential work or able to work from home, we need to continue to maintain these practices of physical distancing to be sure that we can flatten the curve, or in the term that Dr. New and Dr. Tam have been using, plank the curve. And I know that we all appreciate, and certainly after the debate in Parliament last night, we appreciate it even more. Physical distancing does come at an economic cost. Our government has taken, you've heard more about it now, very significant measures to support Canadians through this time. But what I would like to say to Canadians, and I think the whole country gets this, is it is better for the health and safety of Canadians, and in the medium term, it is better for our economy to practice physical distancing now, to flatten the curve, and to be able to get out of this. In terms of specific timelines, I think what we need to do and what we are doing is follow the science and see how the situation is developing, and that's what we're going to do. And maybe Dr. New wants to add something.
Certainly, if you look at the science and the evidence and also the experience of other countries around the world with the COVID-19 pandemic, I can say that it's not days and weeks, but certainly months that this pandemic will endure. So certainly from a public health perspective, we're not thinking it's going to be over in the next few days or so.
Ahead with his plan and turns a blind eye to the impact of the virus. What is your plan to step up screening at the border for everyone crossing it, including essential workers?
Well, I think we announced today some stepped-up border measures, which are very important ones, the mandatory quarantine. And I do want to say about those border measures, I trust Canadians so much. Canadians are great, and people have been making real personal sacrifices to self-isolate and to practice physical distancing. At the same time, I think all of us are going to be and feel safer with mandatory quarantine for anyone entering Canada. In terms of essential workers, we need to be really thoughtful about what we do there. And let me give you the example of truckers, something that we have discussed in government and with business and with labor leaders extensively. We rely on cross-border trade for essential goods like the food in our grocery stores, for essential medical supplies. And those goods arrive very often by truck. So we need to be thoughtful about how the people who provide those essential services, including facilitating cross-border trade, are treated. And that is why Minister Hajdu today very specifically said that the mandatory quarantine will not apply to essential workers. We, of course, understand that the situation in the world and on our continent is fluid and evolving. And as the situation evolves, we are constantly, and by constantly I mean every single hour, reviewing additional measures, including measures at the border.
Thank you, Dylan.
Doctor, sorry, I'll start with Minister Miller. We're hearing about a capacity shift to the south, that doctors are returning from reserves to urban communities, that there's an encouragement of telehealth. Is that shift happening? Are there doctors coming from abroad to fill that? And how does that fit in with the pledge for equitable health services for Indigenous Canadians?
Thank you, Dylan, and thank you for the excellent reporting you're doing on Indigenous issues in particular. There's a number of realities that Indigenous communities face. That includes shortages of nurses, shortages of doctors, and as part of the discussions we're having with Indigenous communities, Inuit, Métis, and First Nations, looking at what that capacity gap is and how to fill it in the most expeditious manner is part of that conversation. And so this is an ongoing discussion that is happening in real time. I'll defer to Tom to answer a lot of those direct questions. But as we identify the needs both for surge capacity, which will allow us to deploy quickly into regions should the epidemic hit in a fashion that we need to act and support rapidly, or getting out that basic public message, that comes with a lot of discussions over financial resources, which I talked to about you today, but also physical resources, personal protection equipment, capacity of to get doctors and nurses on site in a rapid fashion in a way that will best serve those communities. I'll let Tom answer the rest of the question.
Thank you very much, for your question. We are working with the network of physicians and nurses and other health professionals in order for them to be part of the surge capacity should a community needs that. Thank you.
A question for Dr. New. We have provinces that are shifting to satellite labs away from their central labs. Is everything still being confirmed at the National Microbiology Lab? What is the service standard for returning results to provinces? And what is the current backlog of the samples to be tested at NML?
Okay, so in terms of the testing regime, at the beginning of the situation in January, certainly all of the laboratory confirmations were done by our National Microbiology Laboratory. But certainly several weeks in, what happened is that obviously good collaboration between our laboratory and the ones in the provinces and territories. And now we have several provinces that have what we call a validated assay. So there's no need to have that sort of test or reconfirmed at the NML. If one of the provincial labs in British Columbia, for example, Alberta, Ontario, Quebec, validates it, has their own test result as being positive, that's confirmed. It doesn't have to go to the NML. At this point, the NML is there to help some of the smaller provinces that may not have that capacity. And certainly in terms of a turnaround time at the NML, once they get the sample, it takes less than a day.
Okay. One last for the room before going back to the phone. Kelsey Johnson, Reuters.
Thank you for taking my question. My first question is for Dr. New. It's our understanding that C-13 allows the government to, quote, make, construct, use, and sell a patented invention to the extent necessary to respond to the public health emergency. I'm wondering, does this apply to drugs, and could it lead to compulsory licensing for COVID treatments, existing or new, including vaccines?
Okay, that's out of my scope in terms of my expertise. Certainly as a public health physician, we work closely with our colleagues at Health Canada, but if you're looking at licensing regulations and so on, I certainly I'm not in a position to be able to answer that. We do know, obviously, our Minister of Health, Minister Haidu, has approved in terms of some of the new testing technologies. So I can speak to the sort of the posture we're putting forward in terms of our laboratory testing approach across the country, but in terms of specific licensing and regulations, I can't speak to that.
Worth a shot. My follow-up is for Minister Morneau. You have said that there is going to be additional aid and additional measures coming. I'm wondering, can you know when we will see that aid and what areas it's going to be in, as well as when are we going to see the energy package?
We have been working to make sure that we deal with the most urgent and important issues first. And what, from our perspective, we've realized is that there will be Canadians, many Canadians, who find themselves without income, perhaps already and certainly in the coming days. And that's why we've put that at the very first thing on our agenda. Pretty much simultaneously, we've said we need to support businesses so that they can bridge this time from where we are today to when we get through this issue. So that has meant that we need to work on multiple fronts at the same time. We need to make sure that we have adequate financial capability for firms to make that time possible. And so that's why we're working with the banks to make sure that credit is available to businesses, small and large. And it means that we need to be thinking about not only the scale of the companies, but also the particular sectors. You mentioned the oil and gas sector, the energy sector. It is one of the sectors that's particularly hard hit because they have the issue both around the COVID-19 challenge and around the low price of oil and gas as a result of the OPEC decisions. So we know that that's at or near the front of the things that we need to be concerned with, because those small and medium-sized enterprises in that sector are particularly vulnerable. But I want to just make sure that people understand it's multiple sectors. We're looking at the airline sector. We're looking at the hospitality sector writ large, which is facing enormous challenges, making sure that we can deliver from them. In terms of when we'll have more to say, it will be in the very near term. In the coming days, what we want to do is give people a more full understanding of how the impacts will be mitigated to the best extent possible in this challenging time. Today, I think what you've heard us say is not only are we ensuring that people have access to $2,000 a month for 4 months, but that is something that is directly advantaging companies, because the companies don't need to separate their employee from their company. They just need to say, we can't pay you during this time period. And when that happens, there's a direct wage subsidy to people, to employees, so that they can actually live their lives. When this is done, they can go back to work for their employers, and that we think is critically important.
Merci. Opérateur, on va prendre 3 questions.
We're going to take 3 questions, one in French to start.
Thank you, merci. The next question is from Manon Cornelier from Le Devoir. La prochaine question de Manon Cornelier de Le Devoir. À vous la parole, votre ligne est ouverte.
Thank you. Mr. Morneau, I'd like to understand, your first assistance announcement was a week ago already, and you said you were looking at April 6th for an online portal, another 10 days, which brings us to the 17th of April, and Mr. Trudeau says it could take a few days for a check, so that'll lead us to the 27th. So there are 1 million people who asked for EI last week. People really need this money urgently, and you're telling them 27 days from the time of your first announcement and when the check arrives. Is that reasonable given the current situation? How can you justify such a delay? Thank you for your question. I absolutely agree that this situation is urgent, and that is why we found a simple and efficient way to deliver our aid, and that's what we're proposing. We're going to have a system that will be delivered to people, delivering money in the coming weeks. We think it will start in the week of April 6th. I can't tell you an exact date because we're ensuring that our system will be working. Clearly, our systems didn't have the capacity to rise to this challenge, and that's why we're finding a way now to deal with this. It's urgent, it's important, and we're going to be there. It will take another few days, I know. I know it's hard for people, and that's absolutely true, but we have to do this. We have to have an approach that works. Otherwise, the situation will be even worse. In the coming days, we're going to have more details. We'll be able to tell you exactly how and when. And of course, we do have to work together to ensure that we do have a good approach. My question is very precise. I'm not sure if someone can answer it. If you don't have the answer, that's okay. But the work that's being done on this efficient system to distribute funding to Canada, when did the technical work actually begin to make the system work? We heard an announcement last week. We waited for the bill to be adopted, but we want to know when you started to elaborating the system that you're going to implement. Answer. Thank you. We started the approach over the past couple of weeks. So that was already underway, and now we want to make sure that given the scale and the level of demand, that we're able to ensure that the money will be there for people. That's very important. We're going to have more to say about this, and the work was started more than a week ago, and we're going to utilize the most efficient system in the federal government to ensure that the funds are there. And the reason we decided this week to have a single benefit in place for all Canadians in a situation where they're lacking income because of COVID-19 is because clearly we do have to have a system that is efficient and strong enough to make sure that we'll be there for them. And I think we found a good solution, and we're going to continue to work to ensure that the system will function as it should.
Thank you. Operator, next question, please.
Thank you. The next question, la prochaine question, is from Alex Bellinger from Toronto Star. Please go ahead. Your line is open. À vous la parole.
Just on the next steps, I guess, of the financial aid targeted at certain sectors, does the bill that we expect to be passed by the Senate today, this new bill, give the government the power to enact that spending, to send out the next steps of money for this without recalling Parliament, without passing another bill?
I think that question was for me.
Yes.
Yes.
I do too.
So what's clear is we need to have the capacity in the government to act rapidly. We also need to think about the challenge that we're facing. We know that getting the opportunity for credit to businesses, small, medium, and large, is critically important. We know that in order to do that, we need to have the authorities to make sure that Business Development Bank of Canada, Export Development Corporation, both have the ability to deliver. That goes as well for Farm Credit Canada. So the bill, as it's being looked at right now by the Senate, enables us to lift those limits so that we can deliver that sort of financial credit appropriately considered to all those organizations. And the Parliament has approved this morning, as you know, at 6 o'clock, that bill that does allow us that capacity. That's why we're working together with the banks to get to a conclusion on how that can best assure that we get it out in a rapid way to businesses facing challenges.
And just as a follow-up, I think this might be for the Deputy Prime Minister on the enforced mandatory quarantines. We know that a lot of people return from spring break. We've seen repatriation flights in recent days. Will this apply retroactively to people who've come back to Canada recently? I guess will it apply retroactively?
No, the mandatory isolation applies at midnight tonight for all travelers into Canada. And just let me remind people that already when people say fly into Canada, already at those kiosks we're familiar with, you get a screen which strongly recommends that you self-isolate for 14 days, and you have to acknowledge that you have received that strong recommendation. So that is already in place. People are already clearly being advised to do this, and they need to acknowledge that they're advised to do this. We will, from midnight tonight, be taking the contact details of all returning, or well, of all people coming into Canada, and then we will follow up with them to be sure that they are indeed self-isolating, because as of midnight, that becomes mandatory. But let me emphasize, you should be doing it already. This is a step we can all take to protect the health and safety of Canadians, and ultimately to ensure that our economic rebound comes more quickly. If we can flatten the curve, then we can go back to normal life more quickly.
Okay, thank you. One last question on the phone, and then we'll take one from the room and call it a day.
Thank you. Merci. The next question is from Micheline Laflamme. Prochaine question. Micheline Laflamme de Radio-Canada. Please go ahead. Your line is open. À vous la parole.
Merci.
Thank you. Minister Duclos, we've seen that the situation is worsening in the U.S. and they're close to us. And I'd like to know, to what extent does this concern you, and what are you planning to ensure the circulation of goods and individuals? What are you planning right now? Answer. Thank you. I think it's important to always remember that we're lucky to be in Canada in such a crisis, because we do have an extraordinary healthcare system, and also we have a central government that can act quickly to ensure the health of safety of Canadians and our economic security as well. Of course, we're all aware that we have a very large border with the U.S. and that in the U.S. the situation and conditions are different, and we have to do everything necessary, and we will do so in the coming days and weeks, to not only guarantee that the circulation of goods, which is absolutely essential, is done while respecting the health and safety of Canadians. We have to guarantee the circulation, and today we announced the mandatory quarantine of travelers, all travelers coming to Canada, even if they're coming across the U.S. border. This quarantine is now mandatory under law as of midnight tonight. And that's another measure that strengthens our ability to protect Canadians. from challenges and even potentially threats that exist elsewhere in the world, notably south of the border. Is it a possibility? Possibly. Could you consider restricting traffic additionally to avoid contamination increasing in Canada? All options are on the table. We do have to look at all possibilities. Always, of course, with the concern of having essential goods in Canada and medical equipment, food that people need to live and even survive in Canada. But of course, we always have to keep a careful eye on what's happening in the United States.
Merci.
Thank you.
Go back to the room for one last question. Mike from Global. You're good? Okay, maybe one last question on the phone then, operator?
Certainly. The next question is from Lauren Gardner from Political. Prochaine question de Lauren Gardner de Political. Please go ahead. Your line is open. À vous la parole.
Thanks for taking my question. Both the Prime Minister and Minister Duclos have indicated this week that restrictions at the Canada-U.S. border could be tightened even further, depending on how the number of cases plays out in the States. And Minister Duclos, I believe, also specifically mentioned workers in that. Could you describe what it would take, what the threshold might be for the government to further tighten what's already happening at the border? And what do the contingency plans that the Prime Minister mentioned yesterday on the border look like?
Well, I think we've seen today some of the contingency plans that the Prime Minister was referring to coming into force. Obligatory quarantine of everyone coming into Canada is a serious further step. It's an important step, and it should make all Canadians feel much safer. We took last week very careful and very significant measures when it comes to our border with the United States, measures that we took very much in collaboration and cooperation with our American neighbors, and measures that were carefully designed to ensure that essential work, essential trade can continue. You've heard us all today really emphasizing the extent to which the food on our tables, the drugs in our drugstores really depend on that cross-border trade. And I do want to take a minute to thank the truckers who are driving back and forth across the border every day. They are doing important work which we need to actually survive. We are, of course, thinking very carefully about additional measures. You've seen us already in the course of just the past 10 days take a real series of steps to improve control at the border, including the obligatory quarantine. That is something we are constantly reviewing, and we will continue to review it. I also do want to say that cross-border traffic has been decreasing very significantly. So we have been seeing people responding both to these border restrictions and also to the broader message, which people are hearing from their governments in both Canada and the United States, and frankly around the world. And that message is that now is a time to stay home, now is a time to practice physical distancing, and that is what we are seeing on our continent, at our border, and around the world.
And as a follow, Minister Freeland, I'm wondering if you could reflect on what it's been like to make these sorts of calls that you were just describing over the last 10 days, understanding we're in uncharted territory and it's a global pandemic, but given that this government has a history of being of projecting that it's open to people coming from different places, what has it been like to make these calls that are a total 180 of that in some respects?
I don't think they are at odds with our government's core beliefs or my core beliefs in any way. Our government totally understands that our absolute priority needs to be the health and safety of Canadians. In pursuit of that, the federal government, provincial governments, municipal leaders, Indigenous leaders, Canadians across the country have been doing extraordinary things. Our children are not in school. Very, very many people are working from home. Many people are not working at all. We are practicing, all of us, social distancing. I hope all of us are practicing it in ways that have had a huge impact on all of our lives. These are extraordinary times, and I know that we all get that. And those extraordinary changes absolutely need to have an impact and have had an impact on what we're doing at our borders. This is not any kind of shift in our government's views. This is about taking very practical steps to protect the health and safety of Canadians. The 14-day quarantine is very much another step on that path, and we will always put the health and safety of Canadians first. And I think all of us feel very clear and very confident that that is the right direction.
OK, merci beaucoup. C'est ce qui clôt la conférence.
Thank you very much. That wraps up our press conference for today.
All right, and that is our daily briefing from cabinet ministers and public health officials on the pandemic in this country. A big bit of news came out actually in the Senate a short time ago, where Health Minister Patty Hajdu was answering questions from senators around the COVID-19 special aid package. But as she was answering those questions, the health minister announced much tougher measures, a significant move by the government to make sure that travelers returning to Canada who previously had been asked to self-isolate for 14 days are now going to be will be required rather, to have isolation for 14 days under the Quarantine Act. Let the health minister explain this measure.
And effective at midnight tonight, travelers returning to Canada, with the exception of essential workers, will be subject to a mandatory 14-day isolation under the Quarantine Act. This new measure will provide the clarity for those re-entering the country about the essential need to self-isolate. Individuals who exhibit symptoms upon arrival in Canada are forbidden also from using public transit to travel to their places of self-isolation. They will also be forbidden to self-isolate in a place where they will be in contact with vulnerable people. Alternative arrangements for people in these circumstances will be made by the Public Health Agency of Canada.
All right, and that is the Health Minister, Patty Hajdu, with that news. A little curious because the Prime Minister got a couple of very specific questions about that earlier, but did not hint that the federal government was making this decision to use the Quarantine Act to enforce now isolation on people coming from outside of this country. And still lots of questions in that press conference we just left, Vashi, about how that actually works. And I'm still not clear on what that actually means.
Yeah, it sounds like, or at least Deputy Prime Minister Chrystia Freeland seemed to indicate that the enforcement side of things, how it will work, that information will be released later today. But you're right that the Prime Minister got this exact question. Why are you using the honor system? Why don't you use the Quarantine Act to enforce this ask that you have made? And he specifically did not say that it would be used. He said this is what's required. And then minutes later, Health Minister Hajdu did make that announcement that you played. I think two things are important to note. The first is that this, according to Minister Freeland, becomes a legal obligation as of midnight tonight. It also excludes essential workers. So I think that is pertinent to a lot of the people that are going cross-border, right? So you're not supposed to be traveling between the borders right now, but if you are, for example, a trucker who bringing goods that Canadians need right now, or shipping, that kind of thing, it sounds like you would be excluded from this. The other thing is what you highlighted, and that is, so if you are going to enforce this, what penalties do people face if they don't comply? How are you going to even find out that they're not complying? How is this logistically going to work? And the government at this point provided no details on that. As I said, Deputy Prime Minister Chrystia Freeland indicating that specific information would come later today.
And the only other hint I think we got on how it might work is, I think it was the Deputy Prime Minister again saying, we will follow up with them after they have been taken into a different location. Patty Hajdu as well suggesting that the Public Health Agency might house these people temporarily if needed, or get them to their next location in order to isolate in a mandatory way. So that's a big shift, and it's obviously part of the consequence of the fact that the United States does not seem to have a handle on the COVID-19 pandemic in any way, shape, or form. If you look at New York, which we of course share a border with, things are not going well, and when you have the U.S. president saying things like this is going to be over in 2 weeks, that's obviously cause for concern for Canada, so they need to take these additional measures. But it also means all these Canadians waiting to be repatriated will now be in an enforced mandatory isolation for 14 days because some people just frankly weren't doing it and weren't following the rules. I'll go to Catherine if I can, just to circle back on the other big announcement today. There's always news during this time, and that's on the Canada Emergency Response Benefit that the Finance Minister will now receive royal assent for later this afternoon. He was asked about how that is going to work. Catherine, what stood out for you there?
Well, that he's continuing to be pressed about the big question in all of this, which is when is he going to be able to deliver? He was really pressed on timelines. One of our Francophone colleagues there saying, you know, if you look back to the fact that you really made this announcement last week, now you've got to get the mechanism in place, then you've got to get the money out to people. You know, how can you explain to Canadians that this is taking so long? And the government keeps saying, you know, this is an extraordinary effort. It's an unprecedented effort. They are seized with the urgency of this. We got some information from the Prime Minister earlier about the number of people who, for instance, have been transferred over in their jobs, 1,300 people who have come from other parts of government who are trying to help process all of these applications. We know, for anyone who is listening, anyone who might be joining us right now and wants to know what's going to happen, the government is talking about getting some sort of online portal up, perhaps the week of April 6th, and that they want to get the money flowing as quickly as possible after that. But definitely questions about timeline, Rosie. Certainly as we creep closer and closer to the end of the month, and many people have bills that are coming up. I would also note on that question about the Quarantine Act and the measures that Patty Hajdu is going to be putting into place. She did say over the course of the weekend that one of the options open to her are, under the Quarantine Act, are fines and criminal penalties. Now, Chrystia Freeland, Vashi is very right to note, wouldn't give us details today. We want to see precisely what this measure is going to look like in the minds of the government, but we know that that is an option that they have. And I was really struck when Chrystia Freeland said it should make all Canadians feel much safer that the government is now doing this. If it is really going to make that big a difference, if that's not just hyperbole, if it's going to make Canadians at least feel that much safer, some people are going to be asking why they didn't do this sooner.
Yeah, because I should say the essential workers that are already traveling back and forth can continue to do that, as Vashi pointed out. And as the Deputy Prime Minister also said, the amount of travel happening across the border right now is very, very small because you can't travel for recreational reasons. My fabulous producer just sent me this just to remind people what the Quarantine Act does give the federal government powers to do, to fine or jail travelers who disobey quarantine requests. Someone violating direct instructions and potentially placing the public at risk for a disease can face a fine of up to $1 million and as many as 3 years in prison. So it's a serious tool for sure. How they actually enforce it, those details to come. Vashi Kapelis and Catherine Cullen, thank you so much for joining us throughout our special coverage today. Do appreciate it. You can catch Vashi tonight on Power and Politics and Catherine Cullen later on The National. Thank you. As we get updates about the state of the pandemic across the country, we will get more updates, of course, provincially as the day goes on. But let me just tell you that right now there are more than 3,000 cases in Canada and now more than 27 deaths, with Quebec confirming in this hour that there have been 2 more deaths in that province. So with that, let me sign off for my coverage. Thank you for watching here. Let's bring you to Quebec City, where Premier François Legault is providing an update on COVID-19 in the province.
On with our good habits. So 2 more extra deaths and a total of 1,339 confirmed cases. So now I wish to confirm everybody, we have all the protective equipment that is necessary. I admit that we had a few difficulties in the distribution of the material in the different establishments. We are correcting this right now. So there is nothing that is going to be neglected to protect our healthcare staff. There is no reason, because we have all the equipment